Hi, this is Dr. Coucher. We'll be talking about Chapter 53. This is applying your theoretical knowledge and skills of pharmacology with drugs for men's health and reproduction to male patients with chronic, acute, critical, and mental health care needs. Okay, so substances related to male reproductive disorders. Androgens are male sex hormones. They control the development and maintenance of sexual processes, accessory sexual organs, cellular metabolism, and bone and muscle growth. Um, it, we're looking at testosterone at this point. Some of you, I know that there's been some students that work in clinics where they give testosterone injections. I have a friend who he is a chronic pain patient, and there was a long time there where they had trouble managing his pain from all the surgeries that he's had on his back. And he finally got a morphine pump. And so the morphine pump is delivering that dose, a basal rate every hour. And consequently, his testosterone levels have dropped so drastically just related to the morphine. So that he doesn't produce testosterone anymore and has to have supplemental testosterone. Testosterone is our primary antigen, and it's also an anabolic steroid. We will administer this IM. It's well absorbed this way. It is excreted in the urine and bile. Its onset and peak, though, are unknown. You're looking at indications would be hypogonadism and delayed puberty in adolescence. Those are just a couple of indications. You just heard my pain management one. That's another indication for it. Male hypogonadism is a defect of the reproductive system that results in failure of the testes to produce the testosterone, sperm, or both. Androgens include androderm. It's a testoderm TTS. It's a transdermal patch, about 5 milligrams, I think it is. You change that every 24 hours. You don't apply it to any genital, skin, or bony areas. Androgel is another form. It is only one type of androgen replacement drug. There are several others for Testa, Axiron, and Striant. If in use, it is important to teach the man to ensure he receives regular evaluations of his serum lipid levels. Striant is a buccal adhesive testosterone system. It's used to treat the androgen deficiency. It is well absorbed in the buccal area, so think about the mucosal area of the mouth. Anything that you put under the tongue or into the cheeks is going to be well absorbed. An important teaching concern for its use that it must be replaced if it has a slid out of position for more than 4 hours. So I would imagine that could get a little bit expensive using one that goes on the buccal mucosa. Because if it slips out of place or you lose it, then you have to replace it. And I have read some reviews I read about things occasionally. And so reading about medications, I have read that was probably one of the biggest complaints about using that type of system. Other uses include a treatment of refractory anemia in men and women, hereditary angioedema, tissue wasting associated with severe chronic illness, advanced carcinoma of the breast in women, and endometriosis. So testosterone drug interactions, it does increase effects of anticoagulants. It decreases the effects of barbiturates, phenytoin, antagonizes calcitonin and parathyroid. Corticosteroids will also exacerbate edema with it. Lab interactions, it decreases blood glucose in diabetics and increases their serum cholesterol, thyroid, liver function, and hematocrit. So many people that are actually getting testosterone injections have to go and give blood every so often. Their hematocrit is really high. Their blood it's just thick. It's just too much. They'll get really red faced. So that's when the time that we have to encourage them to go and give some blood. Some of the side effects, priapism, I butchered that. Gynecomastia, spermatogenesis is halted. Oligospermia, some adverse reactions: hypercalcemia, virilization, teratogenic effects, hepatic carcinoma. And we want to caution with patients who have hypertension, hypercholesterolemia, CAD, renal disease, seizure disorder in infants and prepubertal children, and also as older men. It's going to be contraindicated in patients who are pregnant, nephrosis or nephrotic phase of nephritis, hypercalcemia, pituitary insufficiency, hepatic dysfunction, BPH. We'll talk about BPH later on in this lecture, prostate cancer, history of myocardial infarction, and men with breast cancer. So you think about prostate cancer and men with breast cancer, you think about this is the hormone, testosterone. Much like women replace hormones with estrogen, it's going to be contraindicated for them with ovarian cancer or breast cancer. So it's the same concept. Anabolic steroids, they're also anabolic androgenic steroids, AASs. Class of steroid hormones related to the hormone testosterone. They increase the protein synthesis within cells, which results in the buildup of cellular tissue, anabolism, especially in the muscle. The class of drug will beef up the masculine characteristics. They'll get growth of vocal cords and body hair. Two new and upcoming ones that are often abused is human chorionic gonadotropin, HCG, Pregnil, Norvarel, and Ovidrel. Tetrahydrogesterone, THG. It is potent and is not approved in the U.S. See, I butcher these drugs. They're very popular with athletes and can be obtained in nutritional substances. There's health risks that go along with it, though, and as they have this and they're taking it on a regular basis, they're at risk of having increased LDLs, decreased HDLs, more acne, high blood pressure, liver damage, and dangerous changes in the structure of the left ventricle of the heart. So these things are, I know that guys want to bump up, but might not be the best thing for them. It could cause a host of other health problems. For looking at androgens in our nursing process, we want to assess this patient. What is their perception? Do they understand why they're undergoing this therapy? We want to look at their weight, their blood pressure, liver and thyroid function. You want to look at their H&H, creatinine, clotting factors. What about their glucose? After they've started it, are they more aggressive? How do they view themselves? We need to note if that patient is on anticoagulant therapy. If we're treating a prepubertal child, it will be important to obtain hand and wrist radiographs before and every 6 months during the treatment. In planning for the patient, we need to have a collaborative effort, starting with the patient. They have to adhere to the regimen. They don't need to sway from it. Reporting of adverse effects immediately is imperative. Goal would be to achieve and maintain a positive self-concept during the long-term treatment. Patient teaching is a very important component of androgen therapy. The man undergoing androgen therapy may not be able to assist in conception if he and his wife decide to begin trying. So we need to make sure we let them know that it may not happen right away because it could take up to greater than 3 months before conception does occur when they're on this therapy. Though it does not seem long, if couples are ready to start a family, it could be a big discourager for them. So we just want to make sure that we give them the appropriate teaching. It can and it will happen, but it may take a little extra time. Let him know that an intermittent approach to treatment allows for healthcare team to monitor his endocrine status because we want to look at it between courses of androgen therapy. And then we want to make sure that our gentleman understands how important it is to keep up follow-up appointments. We don't want them, and here's a big thing. I've talked to y'all about living down in the Delta and having patients come up here. You need to be aware that not everybody has good transportation. So when you're assessing whether they're going to be able to keep their appointment, or they've missed an appointment and maybe you're the nurse in the office who's calling to check on them, why don't you find out, are you having problems with transportation? Because that may be an important assessment, an evaluation to have as to why they're not coming to their doctor's appointments. Side effects the patient may experience: they might have some severe acne. So make sure that they're got a good skin hygiene regimen going on. Men need to report priapism promptly so that the drug dosage can be reduced, because otherwise they're going to have some erectile dysfunction. Report decreased urinary stream to assess for prostatic hypertrophy. The diet, we want to assess their dietary intake. Are they getting essential nutrients? Check and record their body weight several times a week. Might need to cut out the sodium if they're finding out they're swelling. Serum calcium levels will be elevated, so it's important we talk with that man about drinking 2 liters or more per day of fluid. We want to try to prevent some kidney stones. Don't need that on top of everything else. Okay, anti-androgens block the synthesis or action of androgens. Its uses: treatment of benign prostatic hypertrophy, BPH, advanced prostatic cancer, and as a hormonal therapy in the treatment of endometriosis. Other uses for it: treatment of male pattern baldness, acne, hirsutism, virilization syndrome in women, and precocious puberty in boys. Some of the anti-androgens that are out there: leuprolide, that's a gonadotropin releasing hormone that is the most effective inhibitor of testosterone synthesis. Ketoconazole, antifungal drug that has testosterone suppressing effects, and it's similar to the leuprolide. Flutamide ulixin is used to treat metastatic prostate cancer. And aldactone, that's our weak potassium-sparing diuretic. It can be used additionally to treat acne, POS, and female hirsutism. So drugs that are used in other male reproductive disorders, developmental disorders such as undescended testes, can be associated with infertility and testicular cancer. Delayed puberty, secretions of GnRH, LH, or FSH is insufficient in up to 5% of cases with delayed puberty. So we're going to give them GnRH, LH, or FSH therapy. Pituitary and thyroid and adrenal disorders, these result in inadequate pituitary function and can be another cause of hypogonadism. Minotropins, Pergonal, Repronex, those are purified combination preparations of the human pituitary gonadotropins. It encourages spermatogenesis in males with primary or secondary hypogonadism. A patient with insufficient thyroid and adrenal gland function can also experience many problems, including with sexuality, hypothyroidism, and Addison's disease. So sexual dysfunction drugs, and that's when you have a sexual dysfunction, it's the inability to experience sexual desire, erection, ejaculation, and or the phases of sexual response cycle. There's also ejaculatory dysfunction, breaking it down, and there's erectile dysfunction. Phosphodiesterase inhibitors, sildenafil, or the Viagra. It works best on an empty stomach. Its onset is 30 to 60 minutes with a 4-hour duration. Side effects with it: abdominal pain, diarrhea, and heartburn. If a male has an erection that's lasting greater than 4 hours, they need to go to their nearest ER. Levitra is a less effective with a high-fat meal. Onset is 25 to 30 minutes with a duration of 4 to 5 hours. And it can be used only once in a 24-hour period. Whereas Viagra, you can use it more than once. You just need to wait for that 4-hour period to pass. Cialis, not affected by food. Onset is 50 to 60 minutes with a 24 to 36 hour duration. Side effects include abnormal vision and sensitivity to light. With Viagra, also, I don't know if I said this, but you can get a headache with it, and men, if they have high blood pressure, can experience an increase in their blood pressure. The drug interactions. If you want to watch a funny video, I encourage you to go to this YouTube video. If you've ever watched the movie Something's Gotta Give, this is the one where Jack Nicholson is dating the younger woman, and he starts having chest pain. So they're rushing him into the ER. And they asked him if, because they were getting ready to give him some nitro, and they asked him if he had any Viagra, and he said because the women were at the end of his bed, no, I don't have that. Then he tore his IV out. So drugs that interact with the male reproductive disorder medications like the Viagra and the Levitra and the Cialis. Nitrates, isoboride, nitroglycerin, amyl nitrate, and butyl nitrate. Alpha blockers are also will also affect it. Tamsulosin is one of those that if they have a kidney stone, you can take that for kidney stone. It increases the urine flow. So, if they have been diagnosed with a kidney stone, we want to make sure that if they're prescribed that medication, that they don't take any of their other medication. Anti-infective agents, fluconazole, erythromycin, so you have some of your zols and your isins in there that can interact with it as well. Cardiac medications, verapamil, thoradazine, quinidine. There's several of them there that interact. HIV protease inhibitors can interact, and other medications such as methadone, palmozuride, and Haldol can also interact with those male reproductive medications. Now, we cannot talk about medications without talking about natural products. There are so many that are out there on the market today, and there are so many that are actually touted to be used for sexual performance. Now, whether they actually work or not is another thing. You can go and read reviews. I don't know. Probably no one's like me and goes and reads reviews about things, but I learn as much as I can about things. And when I started giving a good friend of mine testosterone injections weekly, I just started reading about these products and if it would help him at any point in time, because he also has some prostate issues as well. So when we are talking about natural products and we are taking care of our patients, it is vitally important that you assess whether your patient is taking these medications or not. We need to know if they're on them, because a lot of them will interact with the other medications. Saw palmetto is often used for BPH. Ginseng can be used for erectile dysfunction. A lot of these medications are out there, and I say that about every medication that a patient's on. If they're taking something that's new, you need to make sure what herbal products they take, because and make sure that they're reporting them on their information sheet. Drugs for treatment of benign prostate hyperplasia. This occurs with a large portion of older men. They may exhibit signs and symptoms of bladder fullness, frequency. They're up all the time at night going to the restroom. And then they have hesitation at the initiation of urinating. We have 5 alpha reductase inhibitors, finasteride, Proscar or Propecia. You have Avodart and Duogen. These are taken indefinitely. They will cause a decreased libido and erectile dysfunction. Women of childbearing age must not handle these crushed or broken tablets. And they just don't need to mess with them due to possible absorption and potential risk to any male fetuses they might be carrying. So, additionally, drugs that are treatment of BPH, the alpha adrenergic blocking agents, Flomax, can be used to promote kidney stone excretion in both male and female. Remember, I talked about that on a few slides back. It can cause postural hypotension, dizziness, and fatigue. Cardura, Hatrin, Uroxatrel, Rapaflo. Take the medications with food. Teach signs and symptoms of postural hypotension. Caution about driving and operating machinery, because if they're having postural hypotension, then they might have a few difficulties with driving, or if maybe they run a crane, or they might run heavy equipment. Inform the patient that orgasm with reduced or no semen does not pose a safety concern and is reversible when the drug is stopped. Advise patient to notify ophthalmologist about use before cataract surgery or any other eye procedures. Okay, so that was the end of your men's health lecture. It was around 25 minutes long. You will have a 10-question quiz over this material, and you need to make sure you apply your nursing process to answering those questions. The questions that are on the quiz are not going to be the same on the exam. However, there's a big however, there will be very similar to that. I want to make sure that y'all get a real well-rounded education in men's health. Thank you, and I will see y'all in the classroom.